What's up? Hope you're doing well today. Wanted to talk about inflammation in the body because I think a lot of times we think it's just all bad all the time, which is not necessarily true. It's a important cascade intrinsically in the body that we need in healing. So, when we look at it as all bad all the time and we try to completely obliterate it with NSAIDs and different medications and such, which I made a video on, very common NSAIDs that can cause compensated hypogonadism in men and can disrupt the ovulation cycle of women up to 92% with consistent use. And that's only for some of the research was showing 14 days for the men and 10 days for the women. So if you want to learn more about that and if you're trying to conceive, that would be something to consider. Also, young men, if you are consuming ibuprofen like a daily multivitamin, to be something to consider. Anyways, to discuss the inflammation cascade and how it works in the body would be important because a lot of the things can be derived from nutrition, what you eat, and understanding this then could give insight into other things like autoimmune disease, eczema, arthritis. They're looking at it in more severe asthma attacks, allergies. There's a lot that goes into it when you dive into how this mechanism works in the body. So let's start with how it begins. Let's say you step on a nail. That's going to suck. You might cry. I don't know. But the point is that is going to enter into the body and the body is going to sound the alarm, starting with cytokines. One of the more common ones that you've probably heard about is interleukin 6, but essentially what those are going to do is it's a alarm system systemically in the body, and it's going to move down to the cells and tell those cells that are injured in the area to upregulate the gene expression of cyclooxygenase. COX-1 and COX-2, those are what NSAIDs work on, but cyclooxygenase is just an enzyme. COX-1 kind of works in the background, has different methods and things that it does, and COX-2 is more of the one that we are looking at for turning off the inflammation cascade. So, what the cytokines do is upregulates the gene expression in the cells of COX-2 and therefore starts the process of pulling arachidonic acid from the cell phospholipid bilayer, which is the membrane of the cell. The reason that arachidonic acid is in there is because it helps keep the cell membrane fluid, and when you have excess of it, it becomes rigid and can be more fragile. Arachidonic acid is derived from omega 6 fatty acids, which come from different things, but primarily in the Western diet, it is from seed oils. So there's benefit to have omega 6 fatty acids in the diet from things like nuts or some different meat sources or what have you, but they come along with like vitamin E, which is a powerful antioxidant, and other things that come along with it. When you just have pure omega 6 fatty acids, is where you find the issue, and you have an excess amount of arachidonic acid. Anyways, the arachidonic acid then converts into prostaglandins. Prostaglandins are little chemical messengers that tell different white blood cells to come to the affected area and essentially clean out the damaged substrate via phagocytosis, which is just monocytes are engulfing the damaged cells. So they remove the damaged substrate and then help the tissue repair cascade begin. So going back to the arachidonic acid, this is where we find issues with excess inflammation. So you need these things in order to heal your injury or fight an infection or respond to a what have you. But the issue lies then with the excess arachidonic acid, which has been shown to create a constant breeding of prostaglandins, specifically PGE2. PGE2 is prostaglandin series 2. And that is the more, let's call it, hammer of inflammation that's just wreaking havoc. So the reason your body responds to that and has all these different things is because when you see things like rubor, calor, tumor, so those are just terms for like redness, swelling, temperature. When your injury becomes swollen, red, warm, it's because it's going through this cascade and the cells are becoming more permeable. The vessels are trying to move more nutrient to the damaged tissue. And that's why you see redness. That is the vessels trying to move that nutrient to the damaged tissue. So this is a positive thing. You want this. You want fresh nutrients, you want fresh blood moving to the cell and to the tissue. The problem is when you have this constantly, then you look at things like leaky gut. Then you can see autoimmune disease or disorders like lupus, like eczema, like arthritis, where the body is essentially always under attack from itself because we have excess things. And a lot of the research now is showing that the overconsumption of omega 6 fatty acids, specifically from industrial seed oils, can be the cause because then you have the overproduction or the overabundance of arachidonic acid in the cell. Therefore, they creates a environment for constant PGE2, the prostaglandin, to be there causing a inflammation cascade. They did research in how it can be causal of a more severe asthma attack. Of note on that too, there was a research study that showed women that were supplementing with omega-3 during pregnancy had a lesser occurrence of children being born with asthma. There was also less instances of eczema in those children. So it definitely plays a role when having a proper ratio of omega 3 to omega 6. But not all omega 6 is bad. We need some in the cell membrane to help keep it, to help the cell membrane itself to stay rigid and not just be a crusty little. Not all omega 6 is bad. We need to have some of it in our diet so that the arachidonic acid can play its role in the cell, allowing it to be more flexible and not so rigid and leaky. So, where do we go wrong though? We have a Western diet that consists of an insane amount of seed oils, and we should see a ratio in the body of omega 6 to omega 3. Should look something like 2 to 1 or 4 to 1. In the Western diet, we see an instance of 15 to 1 or up to 20 to 1. Some of the research shows that 20 to 30% of intake of calories is processed seed oils. Couple that with insane amounts of sugar and refined carbohydrates, you get a litany of issue, not only just with excess arachidonic acid from the omega 6, but insulin resistance, spikes for chronic blood glucose, and all the other things that come with that. So it would be best to then understand that we need to balance out the equation of omega 6 to omega 3. And there's a lot of research that shows when you introduce a quality, not oxidized omega 3 supplement, or you eat or when you source it from a salmon or high fatty fish like mackerel, sardines, all those things, be cautious of mercury content. But the omega 3s disrupt that balance. And why is that important? Is because they then allow for a competitive agonist of the prostaglandin, which is PGE3, which is a less hammer down approach to inflammation in the body. It's more of a, daily driver rather than the all out F1 Formula Racing PGE2 hammer down style. So it would be important to understand that when you get excess arachidonic acid from omega 6 fatty acids, the inflammation cascade ramps up and can lead to a litany of other issues. And it would be important to consider omega-3 in supplementation if you can't get it from the diet, from viable sources, though, because if you introduce oxidized omega-3, you're doing not much better for the instance of inflammation. So, inflammation is not all bad. We need it in the intrinsic response of the body to injury and infection. And we shouldn't be so quick to hammer down with NSAIDs. It's actually shown to be more problematic in the long term healing if you introduce NSAIDs right off the bat, because it disrupts this cascade of the body repairing tissue and going through the necessary protocols for it to heal itself. Alternatively, we need to understand that food matters. If you want to ensure that your body is going to function at its best level, or if you're struggling with autoimmune diseases or arthritis or pain, probably something to consider. And I think we're quick to blame it on aging or something of that nature. And quite simply, all of this stuff can be referenced back to the high amount of arachidonic acid in the cell, derived from a purely industrial processed seed oil that is in near every food that you go into in the grocery store today, because believe it or not, the food industry doesn't have our best interests out there for us, and they've figured out a method of putting together ingredients in order for them to be quite addicting for the human body, to include having emulsifiers in it that coat your mouth with like a fatty feeling, and then pairing it with citric acid and soda to clear out that fatty feeling in your mouth that triggers satiation so that you want to consume more calories in one sitting, and a litany of other things that we could extensively go into. But the primary understanding is focus on what you eat, focus on education and information, understanding, and we all should have some insight on how our body works so that we can be an advocate of what we want in our health and our life. I wrote a full blog on solutions2wellness.org. Go check it out. It dives deep into inflammation. There's a litany of other things, to include the NSAIDs article about how it causes issues in men and women, specifically with hormones and especially around ovulation. So would recommend going to check that out if you're trying to conceive or nobody trying to know somebody trying to conceive and they take NSAIDs. Like, subscribe, share. Thanks.